Hello, everyone. I am Professor Jeyaraj Pandian, the principal investigator of secondary prevention by structured semi-interactive stroke prevention package in India, the Sprint India randomized controlled trial. I'm presenting the results of this trial on behalf of the Sprint India investigators. The recurrent stroke rates are high in India. It ranges from 15 to 20% from community-based studies in different parts of our country. So our primary objective of this particular trial was to assess the role of a structured semi-interactive stroke prevention package to reduce recurrent strokes, myocardial infarction, and death in patients with stroke. There are preliminary information that using text messages and videos, patients have better adherence to medications and also better control of blood pressure and cholesterol. But it is unknown whether these interventions will help in the reduction of vascular events. So the Sprint India trial is a multi-center randomized parallel design adaptive blinded endpoint clinical trial conducted under Indian Stroke Clinical Trial Network, which is a network of 31 stroke centers in our country, funded by Indian Council of Medical Research. The inclusion criteria was first ever stroke patients, more than 18 years of age, who had a cellular device, and they were randomized centrally. The intervention arm patient received an educational book in 12 Indian languages, short messages and videos regularly concentrating on their risk factor mitigation. The control group received the standard of care. The primary outcome was a composite of recurrent stroke, high-risk TIA, acute coronary syndrome, and death at 1 year. The key secondary outcome measures were adherence to medications, the control of blood sugar, lipids, and the lifestyle changes at 1 year. The study was powered for a sample size of 5,800 patients. We randomized 4,298 patients from April 2018 to November 2021. And in the intervention arm, there were 2,148 patients. The number of vascular events, which was the primary outcome, was 5.9% in intervention arm and 5.3% in the control arm. Among the secondary outcome measures, the lifestyle factors like alcohol and smoking cessation were higher in the intervention group as compared to control group. And medication compliance was better in the intervention arm as compared to the control arm. The trial was stopped for futility due to fewer vascular events. Sprint India trial, the intervention did not reduce the risk of vascular events as compared to standard of care. However, there was an improvement in specific lifestyle behavioral factors, including medication compliance, which may have long-term benefits. Thank you.